Nursing Fundamentals Stress and Coping Practice Test. Question 1. A client is breathing rapidly before a procedure and says, "I cannot calm down." What should the nurse do first? Option A. Stay with the client and guide slow breathing. Option B. Leave the client alone immediately. Option C. Tell the client to stop worrying. Option D. Begin detailed discharge teaching. The correct answer is option A. Stay with the client and guide slow breathing. Anxiety narrows attention and speeds the body. Presence and breathing slow the storm enough for safety and learning to return. Question 2. A nurse identifies that a client copes by asking many questions. What should the nurse do? Option A. Provide clear information in manageable pieces. Option B. Avoid answering to reduce dependence. Option C. Give all information at once quickly. Option D. Tell the client questions are stressful. The correct answer is option A. Provide clear information in manageable pieces. Information can be a coping tool. Small clear pieces give the mind handles to grip when fear feels slippery. Question 3. A client laughs while describing a serious diagnosis. How should the nurse interpret this? Option A. It may be a coping response needing further assessment. Option B. It means the client does not care. Option C. It proves the diagnosis is understood. Option D. It should be punished. The correct answer is option A. It may be a coping response needing further assessment. Coping wears many masks. Humor can soften terror, so the nurse looks deeper instead of judging the surface. Question 4. A client becomes angry after hearing surgery is delayed. Which response is therapeutic? Option A. This delay is upsetting. Let us talk about what you need now. Option B. You are being unreasonable. Option C. Other people have worse problems. Option D. I will leave until you behave. The correct answer is option A. This delay is upsetting. Let us talk about what you need now. Therapeutic communication recognizes the feeling without surrendering control. Naming distress can lower the emotional temperature. Question 5. A nurse teaches a client progressive muscle relaxation. Which outcome shows it helped? Option A. Client reports lower tension and slower breathing. Option B. Client refuses all treatment. Option C. Client becomes more restless. Option D. Client cannot describe any change. The correct answer is option A. Client reports lower tension and slower breathing. Relaxation works when the body loosens its grip. Slower breathing and reduced tension show stress chemistry beginning to settle. Question 6. A client says prayer helps during illness. What should the nurse do? Option A. Support the practice if safe and desired. Option B. Discourage spiritual coping. Option C. Replace prescribed treatment with prayer. Option D. Mock the belief. The correct answer is option A. Support the practice if safe and desired. Healthy coping can include spiritual strength. The nurse supports what gives meaning while maintaining safe medical care. Question 7. A client under stress has trouble remembering teaching. What should the nurse do? Option A. Teach in short sessions and repeat key points. Option B. Give a dense lecture. Option C. Assume the client is not trying. Option D. Stop all education permanently. The correct answer is option A. Teach in short sessions and repeat key points. Stress steals working memory like wind scattering papers. Short repeated teaching keeps the message from blowing away. Question 8. A nurse notices a caregiver is exhausted and tearful. Which action is appropriate? Option A. Assess caregiver strain and connect with support resources. Option B. Tell the caregiver to be stronger. Option C. Ignore because only the patient matters. Option D. Ask the caregiver to leave forever. The correct answer is option A. Assess caregiver strain and connect with support resources. Caregiver stress can become a second patient in the room. Support protects both the helper and the person receiving care. Question 9. A client uses alcohol to manage stress after discharge. Which nursing response is best? Option A. Explore safer coping strategies and assess risk. Option B. Praise it as effective coping. Option C. Ignore it because discharge is near. Option D. Tell the client never to feel stress. The correct answer is option A. Explore safer coping strategies and assess risk. Coping that numbs can also harm. The nurse explores safer tools before temporary relief becomes another illness. Question 10. A client says, "Nothing will ever get better." Which action is priority? Option A. Assess for self-harm or hopelessness risk. Option B. Tell the client to be positive. Option C. Change the subject. Option D. Leave the room quickly. The correct answer is option A. Assess for self-harm or hopelessness risk. Hopeless words can be warning smoke. The nurse assesses safety because emotional pain can move towards self-harm if unnoticed. Question 11. A nurse uses active listening with a stressed client. Which behavior shows this skill? Option A. Restating the client's concern in the nurse's own words. Option B. Changing the topic quickly. Option C. Giving advice before listening. Option D. Looking at the clock repeatedly. The correct answer is option A. Restating the client's concern in the nurse's own words. Active listening reflects the message back clearly. It tells the client, "Your words landed here, and I am still with you." Question 12. A client is overwhelmed by a new diabetes diagnosis. Which goal is best for today? Option A. Client will identify one blood glucose management step. Option B. Client will master every detail immediately. Option C. Client will never feel stressed again. Option D. Client will memorize all complications. The correct answer is option A. Client will identify one blood glucose management step. Overwhelm shrinks when goals are small and reachable. One step today can become the first stone in a stronger path. Question 13. A nurse teaches journaling to a client with chronic stress. What is the purpose? Option A. Help identify patterns, triggers, and emotions. Option B. Replace all medical treatment. Option C. Guarantee no future stress. Option D. Avoid communication with others. The correct answer is option A. Help identify patterns, triggers, and emotions. Journaling turns fog into words. Patterns become visible, and visible patterns can be managed. Question 14. A client says deep breathing feels silly. Which response is best? Option A. Many people feel that way at first. Would you try one breath with me? Option B. Then you cannot be helped. Option C. It only works if you love it. Option D. Stop talking about stress. The correct answer is option A. Many people feel that way at first. Would you try one breath with me? Motivation grows through respect, not pressure. Inviting one small trial lowers resistance and lets experience teach. Question 15. A nurse is caring for multiple anxious clients. Which client needs immediate attention? Option A. Client reporting chest pain and severe shortness of breath. Option B. Client asking for extra pillows. Option C. Client pacing before teaching. Option D. Client requesting family phone call. The correct answer is option A. Client reporting chest pain and severe shortness of breath. Stress can mimic danger, but danger must be ruled out. Chest pain and breathing trouble demand urgent assessment before assuming anxiety.